Hi, this is Alexandria Minnesota chiropractor Dr. David Butler. In this blog, I'm going to be referencing an article about failed back syndrome, or what's now known as FBSS, that was published and released by the American Academy of Pain Medicine in February 2001. Now, the headline of the article states, "Back specialists are discouraging the use of surgery as a therapeutic technique for patients with back pain." This is according to one of the authors of this article, Dr. Hubert Rosenoff, MD, who called a moratorium on back surgeries when he realized that after 2 weeks of rehabilitation prior to back surgery, his back patients no longer required surgery. Now, Dr. Rosenoff said this approach can avoid the majority of surgeries. Quote, "Following this kind of concept, you can eliminate 99% of the surgical cases. In fact, the incidence of surgery, if one really looks at this, is approximately 1 in 500, unquote. Now, Dr. Rosenoff was among the speakers in the session Failed Back Syndrome during the American Academy of Pain Medicine, or the AAPM, 17th annual meeting in Miami Beach, Florida on February 14th through the 18th of 2001. Now, back in the 1970s, Dr. Rosenoff was the medical director of the Comprehensive Pain and Rehabilitation Center at the University of Miami, Florida, School of Medicine. And he did a lot of back surgeries. The professor and chairman emeritus in the Department of the Neurological, Surgical, and a professor in the departments of anesthesiology and orthopedics and rehabilitation at the University of Miami, believed his patients were improving. That's what he believed. And he believed they were improving dramatically because of the surgery. But he found out that wasn't the case when he started patients on an intensive pre-surgical rehabilitation program. In fact, he realized that after 2 weeks of rehab, patients no longer had indications for surgery. And that's when he placed a moratorium on surgery. That was back in 2001. And he started telling patients they'd have to go through rehab before he'd operate. And quote, "Nobody got an operation in the first 6 months," he said, which resulted in 99% drop in surgeries, unquote. "Backs don't feel, doctors do," said Dr. Rosenoff. And he argues that the reason for failed back syndrome, defined by some as persistent pain after surgery or other interventions, often happens because the initial patient evaluations are not complete. Now, Dr. Rosenoff says the source of the pain in most cases is not from the spine and surrounding nerves, but rather from the muscles, the tendons, and the ligaments that support the anatomy, he said. Now, Dr. Lynn Johnson, also a medical doctor, was a moderator for the session, and he said that failed back syndrome can occur in as many as 10 to 40% of patients who get the same type of lumbar spine surgery. Now, Dr. Johnson is board certified in anesthesia and pain medicine and a director of the Center for Pain Medicine of North Carolina, which is affiliated with East Carolina University School of Medicine in Greenville, North Carolina. This means, and I'm quoting here, "there is an alarming prevalence to the syndrome," he said. "There's a lot of misunderstanding about what causes back pain at the onset, prior to surgery. Moreover, once they have had surgery and don't do well, there are continued problems in not only diagnosis, but management of the problem," unquote. And it's Dr. Johnson's opinion that while back surgery has a place, there are too many surgeries being done. He said that in some cases, doctors fail to appropriately apply conservative measures such as chiropractic, physical therapy, injection therapy, and minimally invasive procedures before suggesting surgery. I'm quoting again, "Just about any approach is better than having surgery because all the studies have shown that if you take a surgical population and a non-surgical population, they all seem to do the same in 5 years," he said. So if you can avoid surgery and the expense of surgery, obviously you might do just as well as the patient that got surgery. In fact, probably better. Also on the panel was the Dr. James Campbell, a medical doctor and professor of the Department of Neurosurgery and director of the Ballstein Pain Center at Johns Hopkins Hospital in Baltimore, Maryland. And he agrees the problem of lower back pain is ever present. He said that the fact that other countries, such as Sweden, have a lower volume of back surgery than the United States means that we're far away from reaching a consensus about what the right answers are to questions like, when should surgery be offered? Who are the right candidates for it? What are the expectations? And what are the complications of surgery? And finally, what are the chances of making the patient worse? That should be the first concern. And according to Dr. Campbell, neurosurgery has been oriented to addressing a situation such as nerve root compression, which are relatively easy to address surgically, according to him. And in most of these cases, most patients get good results. Around 90% get relief from sciatica or leg pain problems, he said. But the more common problems actually is patients not presenting with clear-cut radiculopathy or sciatica, he said. In these cases, satisfactory results drop to about 60 to 70% of patients, according to Dr. Campbell. So you might look at some of the other videos we've done, because I did address leg pain with chiropractic. So surgery has a role, but the results of surgery are modest, he concluded. And even though this article is now over 10 years old, the failure rate of back surgeries remains near 50%, despite the prevalence of new procedures that are now called minimally invasive. This study is 10 years old, and despite the recommendations of less spine surgery, the current statistics right now in 2015 reveal that there are over 600,000 spine surgeries are performed in the United States each year. And 80 to 90% of Americans will have at least one episode of debilitating back pain in their lives. In 2001, the U.S. had 252,000 lower back surgeries, and that number increased to over 465,000 in 2011. The rate of spine surgery in the U.S. is approximately double the rate in Canada, Western Europe, and Australia, and 5 times the rate that it is in the United Kingdom. And the average cost of spine surgery right now for just a hospital is over $27,000. And that doesn't include the costs for doctor's fees, the actual surgeon, the tests, the scans, all those different things. And despite all the studies, like the one in 2006, done by Medicare and the Physicians Review Panel of experts, they found it was less than reasonable likely that spinal fusion would provide long-term benefit for patients with degenerative disc disease. So finally, surgery is still surgery, whether you call it minimally invasive or not. And the risk of complications for developing scar tissue and future problems developing at levels above or below the surgical site requiring additional surgeries remains. So please listen to what the experts are saying, what their research is saying, and what they're publishing, what they're saying about managing back problems. Surgery should always be your last resort after chiropractic and rehabilitation procedures have been given a good trial. Now, it's been our experience using the Lordex Decompression Center in the last 12 years that our system, we've had many failed back surgery people who tell us they wish that they would have come to us first before they had the surgeries and avoided the complications and the drugs and the loss of function and the frustration of going on and on with pain resulting from the surgeries that didn't help them. And if you or someone you know are considering back surgery, please give us a call and set up a time to explore an option that costs less than a quarter of the typical back surgery, has no side effects whatsoever. Now, if you are interested in improving your health, please visit our website, backfeelsgreat.com. And if you'd like to read the article this blog is referencing, please follow the link below. And finally, I'd like to say thank you for your continued support and encouragement on these blogs. This has been Dr. David Butler wishing you good health. One other thing, if you found this interesting, if you know someone who's considering back surgery, please forward this link to them. Let them see this. And go to our backfeelsgreat.com site. And you'll find a link to our YouTube site, which you're looking at right now. It has several different articles and blogs regarding back surgery. And if they're still considering surgery, have them give me a call. I'll take the time to talk to them and help them understand what they're going through and what some of their options are before they make the mistake of having surgery. You can't reverse the problems caused by surgery by having more surgery. That's the unfortunate truth. So, thank you.